Borderline personality disorder and the diagnosis difficulty and analysis of the consequences as a harm to the career self. Dear friends, my name is Marcelo Paschoal Pizzut. In addition to working as a mental health professional, I also have borderline personality disorder. Therefore, I aim to raise awareness of this disorder in order to reduce its prejudice. I dedicate this doctorate presentation to all those who suffer from borderline personality disorder. The prevalence of this condition characterized by severe emotional instability is estimated to be 6% worldwide. I'm grateful for Salinas University of Science and Literature giving me the chance to pursue this doctorate. I would also like to express my gratitude to Salvatore Fava, my supervisor, for all his assistance. Moreover, I thank my students and patients who were a source of inspiration and support. And above all, I would like to thank my family who have been by my side for supporting me during my training. I sincerely appreciate it. Imagine what it would be like to live in a world that it is both real and unreal. Work or study but dismantle it due to uncontrollable range attacks. You can fall in love quickly and then outgrow it in a few days. To focus entirely in the positive and negatives without giving situations any thought. To experience such extreme emotional distress from being misunderstood to the point attempting to commit suicide or cut yourself. Although the career exhibits symptoms of both illnesses, he is neither psychotic or neurotic, so it sways between normality and craziness. He experiences strong emotional instability, tensions, fears, rejections, impulsivity, irritability, temper, tantrums, jealousy, and lack of control, and it is easily frustrated when things don't happen the way he wants them to. Most of the patients begin to exhibit signs and symptoms in early adulthood or late adolescence. Self-mutilation, present in 80% of the cases, is one of the most crucial elements for diagnosis. Razor blades or any other object are typically used by the carrier to cut himself. There are also cases of people who burn themselves. Self-harm can be committed for several reasons, including venting anger, punishing oneself, disengaging oneself, or trying to refocus. According to the Diagnostic and Statistical Manual Mental Disorder, a person with borderline personality disorder may have the following characteristics: chronic feeling of emptiness, affective instability, frequent episodes of anger and emotional lack of control, recurrent physical fights, unstable relationship, self-harming and suicidal behavior, attempts to avoid abandonment or rejection, disassociation, mood swings over short periods of time, hours, extremist thinking, compulsive behavior by alcohol, drugs, sex, shopping, gambling, etc. Constant feeling of abandonment and rejection, distorted self-image and low self-esteem. Although it has long concerned psychiatry and psychoanalysis theorists because it specifies that do not fit the usual classification profiles. Borderline personality disorder was in fact acknowledged at the end of the 20th century. The syndrome's carriers were neither fully lucid nor fully insane. Therefore, this was an unknown condition to analysts who were unable to find definitions for the characteristics displayed or provide a proper diagnosis to delimit the treatment. Due to the advances in psychoanalytic studies and cognitive behavioral therapy, the term borderline is now employed by the major mental health and general health organizations. However, in practice, the topic still raises a lot of debate because of its challenging diagnosis, and it is frequently mistaken with other disorders that may exist, but are derived from the borderline syndrome. This lack of precision significantly harms the progress made in creation, integration, and integrity of the self of the BPD patient, which is already impaired as a result of the condition. Therefore, this ought to stop. Borderline personality disorder is classified under the category of personality disorder with emotional instability in the International Classification of Diseases, ICD. This same category also includes explosive personality disorder. Both personality disorder, according to the ICD, are characterized by an evident propensity to behave impracticably and the disregard of the consequences and impracticable and unstable mood, a propensity for tantrums and inability to control impulsive behavior, and a propensity to engage in conflict with others, especially when impulsive acts are prevented or reprimanded. The borderline personality is also characterized by disturbance in self-image, the development of projects and personal preferences, a persistent sense of emptiness, intense and unstable interpersonal relationships, and the propensity to engage in self-destructive behavior, such as suicide attempts and suicidal gestures. In addition to sharing characteristics with explosive personality disorder, borderline also exhibits characteristics of bipolar personality disorder, which makes the diagnosis of this pathology very challenging. The DSM estimates that the prevalence of borderline personality disorder is in general population is 1.6%. However, this average can exceed 5.9%. Each occurrence is roughly 6% for primary care patients, 10% for mental health outpatients, and 20% for people hospitalized for mental disorders. About 75% of people diagnosed with BPD are female, though the prevalence may decline as people get older. DSM states that the course of BPD is unpredictable. The most typical pattern is an early onset of chronic instability with periods of uncontrollable emotional impulsivity, abuse of medication, and frequent requests for medical assistance. Young adults are more likely than other age groups to experience the disorder's impairments and suicide risks, which tends to lessen with age. Although people who participate in various types of therapy exhibit some progress during the first year of treatment, the tendency to experience intense emotions, impulsivity, and the intensity in relationships persists, and it is likely to continue for a lifetime. According to studies that monitor patients over time, up to half of them may no longer exhibit a pattern of behavior that would qualify them for a diagnosis of BPD after 10 years. Additionally, between the ages of 30 and 50s, most individuals with illness experience stability in their personal and professional lives. Given this, health professionals need to comprehend and create welcoming strategy for people with the disorder, as well as providing an early diagnosis, since most cannot recognize them. An important component of the therapy of borderline individuals is social intervention, family interventions, which are the initial step of identifying the role of family interactions in the pathogenesis and the maintenance of the patient's symptoms may be required for the treatment to be successful. According to Cabbage, it is necessary to articulate the construction of an entire social network to support the subject. But how to deliver this care without the diagnosis? And how to diagnose if there are numerous uncertainties and challenges that experts in the field have. Therefore, one of the aggravating factors is the lack of knowledge about BPD. So professionals from the areas of psychology and psychiatry must be prepared to understand more about the subject and be able to alter the concepts of evaluation to referred psychiatric pathology. Medical professionals must educate parents about the importance of affection, since this condition is presumably found in the young adult phase and typically brought on the trauma and paternal abandonment in childhood. The person with borderline disorder is fragile and sometimes cordial, friendly, competent, and until gets involved in stressful situation, which makes a characteristic pattern of disorganization, instability of self-image, mood, and interpersonal relationship emerge. People with BPD are prone to brief psychotic episodes when experiencing intense anxiety or unconstructed situation. They also experience episodes of dispersonalization or derealization. Because they cannot tolerate extreme anxiety, borderline carriers generally live intensely, which frequently impact their life. The way these patients are treated is crucial for ensuring that they continue with the treatment. With such characteristics, the disease ultimately has an impact on the interpersonal relationships, and the numerous misconceptions and prejudices permeate their relationships. People with BPD are frequently misdiagnosed and labeled as irresponsible, selfish, imbalanced, and problematic, which only exacerbates their instability and brings them closer insanity, because they will hardly be able to get through the difficult alone. Nobody wants to have a mental illness. Thus, these people primarily need emotional assistance. However, frequently, the patients face poor judgment, which can further exacerbate their emotional state. The signs of borderline personality disorder should facilitate to identify a career because they are unpleasant to those around them, especially to family members. This includes some of the typical symptoms of common psychiatric conditions, including schizophrenia, depression, and bipolar disorder. But generally speaking, the patients do not completely go from the state regarded as normal to be included in such classification. Therefore, borderline syndrome is a mosaic of less severe symptoms of the multiple conditions, which also contributes to the delay in diagnosis, which worsens the patient's conditions. Different people experience different symptoms, including exaggerated notions of illness, dissociative personalizing in the reality perception loss. Other signs and symptoms resemble psychotics with transient, circumscribed episodes of reality-based delusions and hallucinations. Identity disorders is under the cognitive category since it has its foundation on several misconceptions, such as the idea that someone can be wonderful 1 minute and wicked to the next. Borderline personality disorder patients frequently experience tremendous affective stability and act impulsively without thinking through the potential persecutions of their acts. Some indicators of this condition, according to Pereira, are multiple and persistent neurotic symptoms, the presence of chronic, diffuse, and fluctuating anxiety, numerous phobias, compulsions, obsessions, bizarre conversation symptoms, hypochondria, paranoid tendencies, polymorphic, perverse sexual tendencies, paranoid, schizoid, and maniac personality traits, a propensity for impulsivity, and various types of drugs. Addiction. There are additionally emotional lability, exhibitionistic, and dependency demands, and persistent emptiness. In order to diagnose accurately, it is crucial to distinguish borderline personality disease from other psychopathologies due to its unique symptoms and modes of preservation. It is also important to thoroughly examine comprehend the characteristics of the given disorder. As a result, it is essential that those who are suspected of having borderline personality disorder go through a psychiatric evaluation process. The sooner this is done, the less damage to the patient's self. One of the most well-known areas of psychology is the psychological assessment, which offers a more precise and detailed understanding of a person's psychic functioning based on a certain theory. Psychological assessments seek to detect assess many factors to categorize the case of the forecast its course, providing comments on the finding and suggesting solution. However, due to the different defense strategies frequently employed by patients with BPD, psychological evaluations are challenging. The primary ones are listed by Linehan, 1993, Cleveland, which is the division between extremes separating what is good and bad in one from what is good and bad in the other, and primitive ideation, the propensity to think that the once is completely good or completely bad, omnipotence and devaluation, which may work together to portray the I as grandiosity and therefore disqualify the other. Protective identification, where the externalization of aggressive aspects of the personality takes place, resulting in the appearance of dangerous objects from which the individual tries to protect himself. Denial, in which annulment of a feeling or perception occurs, make it lose its emotional content, so that the person treats the subject with indifference. Due to the profound impact of BPD has on the lives of those who are afflicted, as well as the people in their immediate surroundings, the difficulty in diagnosis can be result in several negative effects on their career. In light of all the studies and information gathered for the creation of this work, it is critical to make more assertive psychiatric diagnosis to lessen the harm done to the self of those who have BPD precisely because the diagnosis is difficult. As already stated, the social intervention will play a crucial role in the treatment of borderline patients once the diagnosis has been established. Family intervention, which are the initial step in recognizing the importance of family relationship in the pathogenesis and the maintenance of the patient's symptoms, may be required for the treatment to be effective. According to Gabbard, 1998, the building of the subject's full social support system needs to be explained, and this can be only done after the diagnosis. We delve deeper into the conceptualization of the subject to add comprehension and provide a more precise diagnosis. People with borderline personality disorder exhibit both emotional vulnerability and affective imbalance. According to the biosocial theory, low emotional thresholds and powerful enduring reactions to emotionally suggestive stimuli are characteristics of emotional vulnerability. Affective stability is the inability to regulate or manage emotional events. According to this theory, impulsive and self-destructive behavior typical of this type of condition arises in reaction to unfavorable feeling and serves as a frequent mechanism for controlling emotions. Because of this client may behave impulsively more often when there are unpleasant emotional states present, along with the previously described emotional instability, interpersonal interactions issues, and the trouble managing impulses. There is also a risk for suicide and self-destructive actions. A qualified mental health professional must conduct a psychiatric evaluation to diagnose borderline personality disorder. The patient is more able to accept the diagnosis because of this approach, but the career must have a therapeutic follow-up with a psychologist for an even better outcome. However, diagnosis of BPD is debatable because it can be challenging for healthcare practitioners to treat and manage. According to studies, there is a need to modify the standards, theoretical frameworks, diagnostic and psychotherapy approaches. Recent studies suggest that cognitive behavioral therapy and dimensional personality evaluation should be used as effective assessments and treatment techniques, respectively. Its diagnosis is challenging because it shares many symptoms with other diseases. It is frequently misdiagnosed with bipolar disorder, leading to a delayed diagnosis that worsen the patient's pathological symptoms. Clients with BPD typically present themselves to the therapist with a sense of powerlessness and confusion because they claim to have no idea who they are, what they like, what they want out of life. Their action, both in public and private, frequently conflict with one another. They frequently discontinue their care or utilize their treatments. They frequently struggle to make choices when they present with options. Self-harm occurs in around 80% of people with BPD, although little is known about the underlying causes. According to several studies, this behavior is connected to serotonergic dysfunction. On the other hand, the psychoanalytic literature shows a wide range of psychodynamic justification for self-mutilation, including tension relief, dispersonalization relief, self-punishment, symbolic castration, and ego boundary creation. According to Lopeza, depending on the stage of the condition, the therapy is based on psychotropic medicines, psychiatric and psychological follow-up, which may be connected to individual therapies, group therapies, and even hospitalization to counteract symptoms. Pharmacotherapy is utilized with borderline patients, with an emphasis on patients who are emotional, impulsive, psychotic, and anxious. Antipsychotics, mood stabilizers, and antidepressants stand out among the medications recommended to reduce impulsivity in controlled studies. Lithium, sodium valproate, and the carbamazepine were found to be efficient in reducing impulsivity and aggression. Once more, the importance of early diagnosis is made clear by the fact that any medical treatment necessary for the treatment of BPD are immediately postponed if the individual has it. Even after diagnosis and the beginning of the treatment, allergic symptoms seriously limit the use of medication like carbamazepine. According to published studies, allergic responses happen in roughly 6 out of the every 15 individuals who receive the treatment, and what makes matters worse is that in 3 of these instances it was necessary to stop the medication. According to the findings of a study done with 44 borderline patients, venlafaxine stands out among the antidepressants since it reduces self-harm in 80% of cases and eliminates it in roughly 69% of treated patients. It has also been demonstrated that the use of serotonergic antidepressant reduces self-harm in patients with other diseases such as OCD. Recent studies also show that people with borderline personality disorder significantly reduce their mental disorientation and severe crises after receiving the diagnosis and starting professional follow-up. These studies also shows that the healthcare professional must establish a rapport with the patient, offer advices on the illness and the medication, give the drug following the prescribed dosage, and encourage compassionate and respectful treatment. When given the right support, patients can be considered to be more able to handle the demands of their mental illness. When this professional assistance is also extended to the patient's families and the community, helping them to better understand mental illness, this reflects in the clinical career's conditions. Once the professional is able to notice and watch, formulating, accurate interpretation, defining the area of action with decision making, providing planning assistance, evaluation behaviors, and establishing processes. It helps the interpersonal and therapeutical relationship. Healthcare professionals must be conscious of the fact that they are treating sick people when providing care to properly diagnosed patients, even though it might be challenging to deal with because those affected frequently seem entirely normal. It is important to understand that due to their unstable mood and emotion, they require specialized aid and a different approach than other mental patients. One of the principles that govern psychiatric medicine is also the responsibility to show solidarity with people, groups, families, and communities, aiming at a cooperation between individuals and the conservation and maintenance of the health. The patient with BPD will not receive this treatment if the diagnosis delays, which will affect him in an increasingly expressive way and, as already stated, worsen his depressive condition, which causes breakouts and can even lead to suicide. Carrying out a therapeutic follow-up with psychiatric patients enables to identify common difficulties among them, such as interruptions of daily activities, trouble falling asleep, and issues with medications, whether as a result of resistance to its side effects or outright rejection of its use. The distrust and alienation of individuals who do not understand how therapy works, such as family members and doctors, is one of the challenges of therapeutic follow-up. Due to the psychiatrist's ability to understand the limitation of the patients and assure a feasible treatment for them, therapeutic accompaniment is seen to be a particularly effective modality and enhancing patient adherence to the treatment. In this type of technique, the professional can primarily influence the patient using simulation models. The fact that the professional will be able to work with him in his home, neighborhood, and place of employment, space that for a long time were outside age to the mentally ill, is the most crucial aspect of it. One of the major hurdles for experts in this field is reintroducing themselves into these areas. However, all of these steps, including medication administration, clinical condition monitoring, and the right professional counsel, can only be taken once the patient has got the proper diagnosis. Because of this, it is crucial to take actions quickly before the disease's pathologies worsens the situations for the career. As previously stated, if borderline personality disorder is not effectively managed, it may result in psychotic episodes or raise the risk of suicide and self-destructive behavior. Unpredictable reactions might result from emotional instability, since people with this disease have a propensity to misread certain circumstances. Although there is no known cure for the illness, managing the symptoms is crucial for patients' overall health. In addition, knowing exactly whether borderline personality disorder is curable or not can reduce the negative impacts of this condition on the quality of life of those who have the disease. Understanding the effects of it and looking for strategies to regulate it is the first step. Regardless of the level commitment, a specific intervention procedure can reduce of the level of commitment. A specific intervention procedure can reduce symptoms and assist in rehabilitation of the patient's emotional balance. Even though the medical community has no evidence that this disorder can be completely repaired. Therefore, the patient must be treated to prevent the development of more serious issues. But it is clear that the earlier the diagnosis, the less damage will be done to the career self. More recent research demonstrates that symptoms can be minimized, functionally regained, and quality of life improved when the patient can engage in an effective treatment plan. The therapy period needed to obtain these results when the diagnosis is established before the condition worsen is roughly 2 years. The following characteristics make up the psychiatric diagnostic of borderline disorder careers: situational, low self-esteem related to failures, loss, and rejections evidenced by expressions of helplessness; insomnia related to anxiety and depression, risk of self-harm, risk of violence, anxiety related to situational crises evidenced by agitation, nervousness, irritability, decreased ability to solve problems, and the tendency to blame others. The psychology and psychiatry especially must keep an eye on the patient and other support while creating an efficient treatment plan that is adhered to by the patient's family and the entire multidisciplinary team. Since the psychologist and psychiatrist cannot always be with the individual with borderline disorder, it is equally crucial that the nurturing team is capable of helping them by being a constant presence with the patient and being the primary link between health and the client. The nurse is acknowledged by other health professionals as an articulator and integrator of various knowledge, particularly for detecting changes that occur throughout the day more easily. For this professional must possess the requisite training and ongoing education to enable him to serve any and all public sectors. Personality disorder have been the focus of both theoretical reviews and empirical studies, occupying more and more space in the specific literature. A personality disorder, as defined by the DSM, is a recurring pattern of behavior and experience that does not correspond with what is typical in the culture in which the subject is inserted. It is pervasive and rigid pattern that starts in adolescence or early adulthood, persists throughout time, and causes discomfort or harm to the career, experiencing it as well as to those nearby. Borderline personality disorder is subset of personality disorder, can hold a significant position in the field due its complexity, heterogeneity, and therapeutic challenges. An early diagnosis, however, can overcome this therapy challenge, but it is postponed, as we have seen in this presentation. The results for the person can be fatal. Thank you.
I saw the light fade from the sky. On the wind I heard a sigh. As the snowflakes cover my fallen brothers, I will say this last goodbye. Night is now falling, so ends this day. The road is now calling, and I must away. Over hill and under tree, through lands where never light is shone, by silver streams that run down to the sea. Under cloud, beneath the stars, over snow on winter's morn, I turn at last to paths that lead home. And oh, where the road then takes me, I cannot tell. We came all this way, but now comes the day to bid you farewell. Many places I have been, many sorrows I have seen, but I don't regret, nor will I forget all who took that road. Night is now falling, so ends this day. The road is now